There are two main movement disorders that are responsible for sleep problems. The first one is Restless Legs Syndrome, or RLS, and the second one is periodic limb movement disorder. RLS affects between 9 and 15% of the general population. That's actually a lot of people. People with the disorder have this irresistible urge to move their legs. Some people will say that they feel that their skin is crawling. And if you ignore the urge to move your legs, you can start to feel discomfort in your legs. It just keeps getting worse and worse, especially with not much movement, like sitting or standing for long periods of time. And this urge is usually worse at nighttime. After all, you're lying in the bed not moving very much. And so unfortunately, the leg movement that you do to relieve this discomfort can prevent you from sleeping or prevent you from getting into a deep sleep. Now, RLS mostly affects the legs, but it can affect the arms and the chest and the feet. Periodic limb movement disorder is just slightly different. With this disorder, people experience movements of their lower extremities that last about a half a second to 5 seconds, and it occurs within the first few hours of sleep. Most often, you're not even aware of these movements, but you still can experience partial awakenings throughout the night. Most people with RLS also have periodic limb movement disorder, but the limb movement disorder can be present in other sleeping problems, even with people who don't have RLS. Primary RLS happens all on its own, and it can run in families, meaning you can inherit it, and we really don't know the cause of it. Secondary RLS, on the other hand, can result from certain drugs, iron deficiency, pregnancy, anemia, and even peripheral neuropathy, which you can see with diabetics. What can you do about RLS? Well, if you have RLS from another problem, like secondary RLS, you would treat that other problem first. Then there are some behavioral things that you can do, such as decreasing the things that make RLS worse, like caffeine, alcohol, and tobacco. Also, keeping a regular sleep pattern, regular exercise, taking hot baths, massaging your legs, and even applying heat or ice to your legs can also help RLS. Another intervention that has been studied is the use of pneumatic compression devices. Now, if you've ever had major surgery, these are those inflatable wraps on your legs that they put on your legs to keep your blood flowing until you're able to get up and walk. So it squeezes the legs, which offsets the urge to move the legs. As for medication, sometimes iron supplements help even with people who don't have an iron deficiency. Other choices would be things like dopamine-enhancing agents, and dopamine is a chemical in the brain that's involved with mental activity. Some examples of these would be pramipexole and ropinirole, just as an example. Also, benzodiazepines, which are usually thought of as anti-anxiety medications, can help, as well as anti-seizure medications.